your living is worrying some people, and they will need to punish you. And to punish you is to do something to one of your son or your daughter or your relative, so that you feel the pace. But if they are to you yourself, it's rather your people that is feeling the pace. But they want you yourself to feel the pace. So in order to make you feel sad, they have to make sure that some of your children are not better.
And that time you believed?
I believe it. I believed that it's true. Because what kind of disease is that have no cure? We all know that is, but that disease is not. We went to the hospital, that is not is. But what kind of disease is that? If every day they will cry the whole day. Pains. See, so I have to believe.
Josiah had no choice but to believe, because no dosage of the strongest painkiller can kill the pain, as Dr. Julia Kakari of the Tema General Hospital explains.
A young boy, I think he's a frequent patient, so most of the nurses knew him, and he came with severe pain. God, we had to give him iron pethidine. It wasn't enough. He was begging for even more. And we were even scared that she become addicted to it. At a point, I think she even knew, he even knew what that drug was. So he kept on asking me for it, even though we had diclofenac and other medications. But then he knew that was a drug that really released him of the pain. The iron pethidine is a very strong analgesic, but that wasn't even enough for him. Wow. Yeah, so the pain is serious.
Orthopedic surgeon at the Konfanochi Teaching Hospital, Dr. Vincent Ativo, says lack of blood circulation is usually the cause of the pain.
Due to reduction in the blood supply to the bone, the joints, and many other organs in the body, like the kidney, the liver, the brain. That's the commonest cause of admission in sickle cell disease patients.
So in Zuarungu, where Josiah's children, 6-year-old Emmanuel Abuni and 15-year-old Jonas Abuni with sickle cell are, only witches or the gods can inflict this kind of pain as a form of punishment.
They said they have taken him to where they are cooking, and then they put the soul under the stones. So whenever they are cooking and then the stone becomes heat, it's there that the body also becomes heat and feel the pains. That's what they told me, so I believe it. Because any time at all, when they treat it for some time, it will come back. When I buy painkillers for some time, it will come back. So I just believe that it's because of the witches, that is witch hunting.
So Monday, 19th of June is a day for us to have conversations about a fatal disease, sickle cell disease. And that's exactly what we're about doing here on the show. Earlier, we played to you some excerpts from a documentary that was filed by Seth Kwame Boateng, Pains from Cursed Cells. And I know my guest will have something to say definitely about that title. Dr. Ama Bene Akwesikuma is with the Department of Hematology, the Kolebu Teaching Hospital. Good morning, Doc.
Good morning, Aravi.
Thanks for being here.
It's a pleasure. Thank you for having me.
Sure. I guess my first question would be, why does it in some cases take such a long time to identify that somebody has sickle cell?
It's all about awareness. Because of the nature of the disease, traditionally certain attributes have been, fashioned to the condition. So in the layperson a family would have somebody who always has bone pain, what they call rheumatism, okay, especially during the rainy seasons and when it's cold. And then unfortunately the person will lose their life, and maybe 2-3 other children will also go through the same way. And then as the excerpts shown earlier, they will attribute it to witchcraft and all that. So it's all about awareness, yeah, and seeking health, you know, a facility as soon as possible, and not going around looking for answers.
At what point do the health facilities do the tests? Is it one that you have to ask for them to do? You know how it's easy when somebody asks, oh, what's your blood type? And you're quick to say, but when they say you're sickling, then you're not sure what that is.
Well, we do not have a national newborn screening as in other places where as soon as you are born, you are done. It has been started. It was started by Dr. Kweku Ohimfrempong, did a pilot program in Kumasi. But having said that, I'm sure there will be plans to do it nationwide. But having said that, unfortunately, it's when they get ill and they go to the hospital, that the doctor, putting everything together, would suspect that the person has sickle cell disease. But now you have children also entering the creches and all that, being asked to be screened for sickle cell.
Okay.
Usually it will present when the person is less than 1, when the child is less than 1. There are certain changes that you would find.
That's if you haven't done the tests.
That's if you haven't done the test.
Okay.
Yeah, so it can be detected early. It's all about getting to the hospital on time. Yes, and not wasting time. Let me go a bit into what sickle cell is.
Sure.
It's a hematological condition, and blood that we see, we normally see it as a fluid. But within the fluid, there are cells in it. 3 main types. We have the red, the whites, and platelets. Now within the red, we have hemoglobin, it's a protein inside. And that's what gives us, carries our oxygen all over the body. Okay. Now, there are different types of hemoglobin, and the normal one is hemoglobin A. Okay, when you are in your womb, there are other ones, but you come out with hemoglobin F. And within 3 to 6 months, you are supposed to change to your adult hemoglobin, or the hemoglobin that God gave you. Okay. So it's within this change that if somebody has an abnormal hemoglobin, that's an S or a C, or those are the 2 main types. That is when the manifestation starts. Okay, that's when the manifestation starts. So when we say somebody has sickle cell disease, and we inherit each gene from a parent. So the father gives you 1, and the mother gives you 1. So when we say somebody has sickle cell disease, we are saying that one of the genes is an S, and the other is abnormal. So it could be a C.
Okay.
Definitely not an A, which is the normal type. Okay. Now, when we talk about sickle cell anemia, we are saying that both genes are S. So the person is SS. So that is the sickle cell disease and sickle cell anemia, and that's the severest form of sickle cell disease.
Oh, okay.
And I know a lot of people also confuse your sickling status with your blood group. Now, the blood group are just proteins around the blood cell, giving you a certain blood type. But with sickle cell disease, we are talking about the hemoglobin, and it's within the red cell. So one is out and one is within. But the normal hemoglobin type is A.
Okay. So when you have the AA, what does that mean?
You have your normal adult hemoglobin type.
But you still inherited from your parents?
Yes. The inheritance, sickle cell disease, or the inheritance of hemoglobin is from parents. Mother gives 1 and father gives 1. And depending on which one is given, you have your hemoglobin.
Okay. So when you have SS, we say you have sickle cell anemia.
Yes.
But when you have AS, then you have the sickle cell disease.
No. You have a trait.
A trait of the disease.
Just a trait. You don't have the disease.
Okay.
The disease is having an S and the other hemoglobin being abnormal. And some of the abnormal hemoglobins are C. Sometimes you can get beta tal and other things.
So which one is the most common in Ghana? I haven't heard about the C. All I hear is the S.
The S.
Yeah.
Yeah. When you say the most common in Ghana, I would say that is the normal hemoglobin, which is your AA. Having said that, about 25 to 30% of people have the trait. That is, they would have one S.
In Ghana?
In Ghana.
Okay.
And then in a study done, the pilot program I referred to, spearheaded by Dr. Kweku Ohin Frimpong, they realized that 2% of the newborns had an S.
Okay, that's
Sickle cell
one
disease.
S.
Yes.
Okay.
Yeah.
So at what point, there's a common thing that you do when you go to the hospital, which is to take a full blood count.
Yes.
Which does not include the sickling.
No.
Does it? Okay.
No, it doesn't.
Is there something that when it's noticed within that test that you've done, they can say go and do a sickling test?
Not the full blood count.
Okay.
So usually when you go to hospital, the doctor will ask you your complaints. And from that, the doctor will ask you certain things, all to find out exactly what is happening. After that, you're going to be examined. And certain features might point to the fact that, no, maybe this person has a sickle cell disease or anemia. For example, if the person comes out complaining of pain, bone pain, the doctor might ask, is it something that happens? When does it happen? So once you get the history that maybe it's only during the cold season or when I do strenuous exercise or something, then the doctor would go on to ask, do you have anybody in your family with that condition? Okay, so it's more like detective work. Then you examine the person. If it's a baby, you realize that we have what we call dactylitis. You have the hands and the feet swollen, and the baby will always be crying. This is about 6 months when the hemoglobins have changed. Okay. Now, if it's a child, you realize that he has a prominent forehead, which is called Borson. And then when you look into the mouth, you realize that the gum is a bit forward, and that's natopathy. So these are some of the things that the doctor would put together with your history, and then determine what tests that you should do. Now we have screening tests. So you do your sickling test. So the sickling test will just look at the red cells and find which ones that are sickle. Sickle really means that the red cell will form a sickle shape. Sickle shape because the hemoglobin assumes a certain position under stress.
Okay.
Yes, so that's what gives you the sickle shape. So your screening test, you do a sickling test. Sometimes you can do a solubility test. These just two tests will tell you that there's a presence of an S. But it doesn't tell you the presence of any other hemoglobin.
Okay.
So you know you have an S. So eventually the person might even just have a trait and not have the disease at all. So you go further to do what we call HB electrophoresis. That one, we just run your blood, and then the different hemoglobins will be spaced out. Depending on their positions, we can tell you the type of hemoglobins that you have.
Okay. Yeah. So when you have the traits,
yes,
does it pose any threats at all in the person's life?
Not significantly, no. Once in a while, some people will complain of maybe some pain, but really, it's nothing at all. It becomes important when the person is getting married.
Okay.
Okay, it really becomes significant when the person is.
What's the doctor's advice if you're AS?
Well, for me, we give my personal view is to give informed, to make the person give the opportunity for the person to have an informed decision. Okay. Now, if you are an AS and you get married to someone with an AS, okay, depending on which of the genes you are going to give to your child. Okay, for every pregnancy, there's a 25% chance that you're going to give birth to somebody with sickle cell anemia. 50% chance of giving birth to someone who is a trait or a carrier, that's an AS.
Okay.
And then another 25% chance of giving someone who is normal and has no sickle cell.
Oh,
yeah.
Okay.
But that's for every pregnancy. Unfortunately, if we have two of such people, you realize that in real life, the firstborn SS, second SS, third SS. So you really cannot tell. You can't say that maybe I'm going to have 4 children and one of them is going to be normal, one of them is going to have SS and that kind of. For every pregnancy, that is the probabilities.
Okay, but in the same way, somebody can also have 4 children. Somebody who is a carrier,
yes,
but will not
precisely
give it to any of the children.
Yes,
they will only have traits.
Yes.
Okay, so you still haven't told me what the doctor's advice is. What yours is to just expose.
Precisely. Okay. For me, mine is to give you all the information and to give you some of the challenges that you would have, especially if you have a child who has sickle cell anemia. Okay. Yes. All and then you take a decision.
Okay. We're going to be talking about how it feels like living with this disease, but we've also put a post on Facebook, so we'll read a lot of your messages. You can also send me a message via WhatsApp and regular SMS with the number that you see on your screen in a while. So we'll be joined by Dr. Sefako Enam-Bankes, who is founder Sickle Life. But on to your question now on Facebook. What do you want to know about this condition? That's what we're talking about right here on the show this morning. So let's go to some of the things that you're asking so I can put that to my doctor in studio this morning. Apana Chow says, this sickness is really tricky, but I want to know if you can detect it at the early stages. Sharif says, what are some of the foods or measures to cure or prevent sickle cell disease? Abeko says, so it means someone with AS cannot marry another with same AS because all their kids will be SS. Well, that's almost like a myth, but you know, there's a possibility you can have children with AS and there's a possibility you can have children with SS. You cannot say. Kofi Sapon says no, they stand. Okay, so Kofi Sapon essentially given that doctor's advice that we've just received to Abeko. Thank you, Kofi Sapon. Fortune says it's not all about marriage. You can marry and decide not to have kids. Don't we hear that often? And then what happens? So if you've got questions on Facebook, of course, I would love to see them. So keep those questions coming through, and then also send us questions via WhatsApp and also the regular SMS. Okay, so we've been joined by Dr. Sefako Enam-Bankes. She's founder Sickle Cell Life. She's also a person living with sickle cell disease. Good morning to you.
Good morning.
Thank you for joining
the
conversation. Of course, I do have Dr. Ama Bene Akwesikuma right here, still in the studio. So now that you've joined, can we find out what your experience has been? How long have you been living? Okay, I mean, that would be all your life, really.
Yes.
Okay, so how is it like? How have you managed?
Okay, so I can't exactly remember when I was first diagnosed, but then my mom said when I was about 6 months, I had what is called dactylitis, as Dr. Bene has explained, hand-foot syndrome. So that's just inflamed digits, so they are painful. And as a parent of a child who can't complain, who can't talk, you know, it would be quite difficult to manage such a condition. So that's where I was first taken to the hospital, and then tests were run. Then the diagnosis was made that I have sickle cell hemoglobin C disease. So it's not SS, it's SC, which is a variant.
Okay.
So, and from there, it's been quite a challenging life. The earlier days, it wasn't so bad. I was in a basic school close to home, so the supervision was always there. My mom would ensure that I was always drinking a lot of water, eating healthy, not engaged in too much physical activity, because you don't want to precipitate a crisis as much as possible. And also I was on routine medications, so like folic acid, and then going for regular reviews. So they'll pick up anything sinister before it occurs. But then as I went on, things became more difficult. So for example, in senior high school, I went into the boarding house, and you can imagine it's like a change of environment, it's more stressful, the supervision is not as strict. So one of the challenges was waking up at 4:30 a.m., going to the washroom that's not like within the house, it's quite far off at dawn, the cold. And it was quite difficult to get the authorities to give me hot water. Like They thought it was a favor. They thought
like a privilege.
Exactly. Like
You're
why
a
should you?
kid.
Exactly. Why should you get hot water when everybody is bathing normal water? And you know, as I said, the precipitants. If you don't get the things that you need to prevent the crisis, you would get the crisis. So then, high school was very difficult. I kept getting so many crises. I'd be on admission, get discharged, come back to school for like 3 days, be on admission again, get discharged. The good thing, however, was because of the condition, my mom made the choice for me to be in a school in Accra. Because I'm just thinking, what if I was far off and my mom had to like come to maybe Cape Coast or something? Because I thought I could go to like one of the great schools out there. Yes, but then it was a good decision to stay close to home. And so eventually, from the boarding house, I had to leave and then be at home and then be a day student because the crises were too many. And I had the aspiration of being a medical doctor, and you can't afford to be missing like so much school. Yes, so then after that, there was medical school. And as you can imagine, medical school is stressful, like very stressful. So then again, I kept having a lot of crises from time to time. I'll get admitted. And then
even in the medical school.
Even in medical school.
When there's so many doctors around.
Yes, because as I said, it's stressful and stress precipitates crisis. So if you are staying up a lot, you're staying on your feet the whole day, and at a point in medical school, my crises, the frequency changed from the normal about 3 to 6 monthly crises to in a month I could get like 3 or 4, and it didn't make sense. Like we know our pattern, we know our steady HB, we know what's going on. But then around that time, it was just so frequent, and the medications that my body would usually respond to, that's the analgesia, the painkillers, at that time, my body wasn't responding to them. So then at a point, my mom suggested that we see an orthopedic surgeon because she's a nurse, so she knows a bit about these things. And so they suggested we do an MRI. As you can imagine, MRIs are expensive. Not everybody can afford.
So MRI is exactly what? Describe that.
That's a magnetic resonance imaging. So you basically go into a huge machine and then it scans your body and it's trying to pick up what's happening inside you. So I know you know about like a CT scan. Yeah. So then another modality is an MRI. We want to see what's happening within. So lo and behold, we go and we find avascular necrosis. That's basically the bones are not getting enough oxygen, so then they begin to break down. And it's a complication of sickle cell disease. And Dr. Benny has already explained what happens with the obstruction of the vessels everywhere. But then there are so many complications all over the body. So one of the common ones among people like me, young people, I know so many young people up and about, but then they have avascular necrosis. So then at that point, fortunately it was early, so we were able to, what we started was what we called intensive physiotherapy. I like that they called it intensive because I was still in medical school, but then every week, 3 times a week, I had to find time out of the schedule to go for physiotherapy. And as you can imagine, with how we behave in Ghana, people are scheduled for physio at 10, they come at 11, I'm scheduled for 12, I go and then there's someone there, so my physio will be at 1, but my next lecture is at 2, so I'll go back late and it's like nobody really knows what's happening. So then it happened for a while, but then I got better, it worked, because then I didn't need to take the painkillers as frequently as I was taking them, and then I had to stop. I used to like to jog.
But you had to stop jogging because of the
I had to stop jogging, I had to stop playing basketball. I just like to do I know, like conventionally, you're not supposed to do so much physical activity because the oxygen requirements are more when you are doing those things. But then I just like to keep active. So I just had to stop everything because it puts too much.
So you still don't?
I don't, because I mean, it's a risk. I can't afford to do those things. Even with my posture, with my standing, during physiotherapy, I was taught how to sit appropriately, like how to lift off from my bed or my seat so that I'm not putting too much weight on my joints, etc. But the unfortunate thing is that most people can't afford an MRI at the early stages. So the person will be having pain, chronic pain in their hip for a very long time. They will think it's just a crisis, and then nobody would actually think to do an MRI, or even when they are told to do an MRI, the person can't afford 1,000 cedis like
so
spontaneously.
Can I ask you to describe what crisis in your case would mean? Can you describe a typical crisis?
Okay, so one, it can occur in any part of the body. Typically for me, it's in the long bone. So it could be my thigh, it could be my leg, my arm, and it's just pain, excruciating pain. Sometimes it's manageable. When it starts off, you can use a hot water bottle, use some light analgesia, but then it gets to a point where it's so painful, you need to go to the hospital. And unfortunately, our sickle cell clinic, due to circumstances beyond our control, doesn't run 24 hours. So then sometimes you have to end up at the general surgical medical emergency, for example, at Kolebu. And I mean, there are people having heart attacks and hypertensive emergencies. So when you come saying
your emergency is not an emergency.
Yes,
as compared
on
to
the
other
scale
people
of
who
things,
have, yeah.
on the scale of things, because people have to be triaged, like in the
Yeah.
order. I mean, someone having a heart attack.
Dr. Bene, you can relate, right? This is real.
Well, for me, a sickle cell patient in crisis is an emergency.
It is,
but is that patient treated, is that case treated as an emergency when you have other emergencies such as she described?
It should.
It should, but the reality is, unless you go to a sickle cell clinic where you would get the emergency care,
Yeah.
everywhere else, you'd sit for a very long time in excruciating pain.
So do we have a sickle cell clinic?
We do at
Okay.
Kolebu, and actually
Only Kolebu in Accra?
That's where it's a structure
The biggest.
separated, you can see. But then other facilities run sickle cell clinics on like specific days. So then the whole like OPD is designated to run a sickle cell clinic. So then the patients would come there on that day. But then the sickle cell clinic is at Kolebu.
Okay. So is this disease captured under the NHIS when you have the conditions and you go to the facility?
No.
Wow. Wow. This must be very expensive too.
It's so expensive to manage sickle cell disease. I keep telling people, and everybody keeps talking about advancements in medicine and science and how now if you have a child with sickle cell disease, they can manage. But then I mentioned an MRI. How many people can afford an MRI at the drop of a hat, just like that? But then we talk about like there's hydroxyurea now. 500 milligrams is 3 cedis. So then,
okay, what is that? Because
okay,
you're talking to Dr. Bede and you're looking at her.
okay, so then there's this new drug. It's a wonder drug for people with sickle cell disease.
Okay.
What it does is that it reduces the amount of like hemoglobin S, the abnormal hemoglobin in the blood, and also increases the hemoglobin F, as Dr. Bede has already explained. So then the amount of like sickling episodes reduces. So then complications such as strokes, acute chest syndrome, these major complications are reduced. Now, however, it's not on health insurance. If you want to get your medication on health insurance, you'd probably get folic acid, you'd get paracetamol, you get IV fluids.
And I can imagine that will probably do nothing when you're in crisis.
Yeah, like, I mean, you can go to the drugstore and get that yourself.
Is there a conscious effort to try and get the disease and the conditions covered by NHIS?
I had the opportunity to have a presentation at a Ministry of Health event, and I voiced out some of my concerns about how sickle cell disease is addressed under the health insurance scheme, and the posturing of the health insurance authorities that from their perspective, they've covered sickle cell disease under health insurance. So if the facilities do not provide the things that they are supposed to provide, then we can't lay blame on the health insurance authority. Okay. But then the reality is, if the health insurance authority is not providing the things that the facility needs, then obviously the facility, being in debt for a long time, is not going to provide what the patients need. So then we all suffer. Currently at the sickle cell clinic, I have health insurance. But when I go, because of lack of subventions and things like that, just to keep the clinic running, so that when I'm unwell, I can go there. Even with my health insurance, I need to top up for my full blood count, for my BU and creatinine, for my medication. Otherwise, the clinic will shut down. And this is a clinic that is running supposedly running on health insurance.
Yeah.
So for people who have the condition but then cannot afford that extra money to top up,
Yeah.
the person may have crises. They know they're supposed to come to the hospital, but then they really cannot afford to top up. So they will stay at home, and then they would come when they are very severely ill, and then everybody will be upset.
Sure. Dr. Ben, I'd like to end with you. Unfortunately, we'll have to wrap up. I don't know if this is a myth or this is reality, that persons living with not the disease, who have the sickle cell anemia would die at a certain age. Is that correct? That you can't live beyond a certain age?
That's not correct. Once you can see Enam, I'll thank you so much for this opportunity and for Enam being here, so that it gives hope to people with sickle cell disease. It's an inherited condition. There's nothing you can do about it, but it's the way you take it up, the way you accept the challenge, the way you are determined to change your lifestyle to suit it, the way you are determined to do things that will prevent the crisis from coming into being, so that you can have good quality of life. I think for me, that is the best thing. I would say that we have people in high positions as well as, everyday positions, so to speak, who have sickle cell disease. They might not even tell you, but they do have it. So it's really the way you look after yourself, the way you are prepared to forgo, because as Enam was saying, she was into sports. But when she realized that, no, it's not helping me, she's had to stop, you see. So it's not a curse. I believe that it is a challenge that one can take up and make the best out of it.
Okay, all right. Thank you very much for your time this morning. And thanks for sharing. How long have you been, you're a doctor for how long now?
3 years.
All right, congratulations.
2 years.
Good for you. Enjoy it. Thanks a lot, Dr. Bennett, for your time as well. It's now time for entertainment. It's brought to us by Airtel and Becky. We'll be right here. Stay with us.